These days, every other person in my neighborhood, as well as the patients visiting me in the clinic, are complaining of typical symptoms of high-grade fever, severe body aches, joint pains, swelling on the joints, and sometimes a rash which is generalized all over the body, a maculopapular rash. These are the classical clinical symptoms of Chikungunya virus. So, what is it? Why is it getting so common these days? How is it transmitted? What are the symptoms? And what can you do about it? I'm Dr. Mariam Atiq, and we are going to talk about this so that you can be aware and you can keep yourselves safe. This viral infection was first discovered in Tanzania in 1952, and it was named from the Kimakonde language, where chikungunya actually means to be distorted. The person is in so much pain, there are so many muscle aches and joint pains and joint swellings that the person cannot sit properly, and they are just contracting themselves, they are moving themselves, they are just turning and tossing, and that is why the name of chikungunya has been given, the contorted form. So this is transmitted by the vectors, the mosquito bites. We have already discussed about dengue and malaria. This is another infection that is brought to the humans by the bite of the infected mosquito. They mainly belong to the Aedes family, the Aedes aegypti, which also carries the dengue virus, and the Aedes albopictus. These are basically the day mosquitoes. They are more active towards the daylight hours, in the daylight hours mainly, early morning and at the evening time. They live in water, clean water and dirty water. So they can replicate very easily when the season is hot and humid, and their bites can cause all these different kinds of infections, the viral illnesses. After the infected mosquito bites, it takes about 2 to 12 days. On an average, you can say about a week for the symptoms to develop. The symptoms we have already discussed. Sometimes there may be involvement of eyes also, with redness in eyes, clouding, irritation, watering. Then there may be headache, nausea, vomiting. These may be associated with the classical symptoms. What you can do about it? When you suspect a person having these problems, take them to the doctor so that they can be screened. There are blood tests available. In the first week of the illness, there is the reverse transcriptase PRC test which can be done, and later if the disease has progressed to the second week then up to from the second week to 2 months, the chikungunya viral antibodies against this virus can be detected in the blood. There is no specific treatment. All we can do is to treat the symptoms that are coming. For the pains, the painkillers can be given. For the fever, the antipyretics can be given. If there is a headache, if there is nausea, then the supportive medicines can be given for these problems as advised by your doctor. What you can do on your own part is to take lots of rest, drink plenty of water, eat nice food so that you can build up your own immunity to fight against this viral infection. Now, how do you prevent the disease? Up till now, there is no specific vaccination for this prevention. So, what you can do is that you can prevent the mosquitoes from biting you. That is your major weapon against this problem. And how do you do that? So, the very first thing, try to avoid going out in the early morning hours and the later evening hours when the mosquitoes are most active. If you have to go out, then cover yourselves properly. Full sleeve clothes, wear pants, full pants, and those areas which are still exposed, you can use mosquito repellents on them so that the mosquitoes cannot bite you. Then when you are inside the house, as these breed in the water containers, so the water in any of the buckets, in any of the drums, if you have indoor plants, it should be cleaned and it should be circulated regularly. Throw away the old water and put in fresh water and then cover it up so that they do not get the place to breed. Then there can be mosquito netting which can be put on the windows and doors. Then when you are sleeping inside, use mosquito nets which can be put on the bed, especially for elders and the little children who are more susceptible. Then the insecticides can be sprayed inside the house also to prevent any of the mosquitoes that are hiding in the nooks and corners from staying alive and coming and biting you. Then you have to maintain cleanliness in and around the house. Especially in the communities, there has to be proper cleanliness. The garbage disposal has to be arranged properly. The garbage pickup has to be done from the areas, and no stagnant water pools should be lying around. This has to be done on the community level. In the house, wherever are your dustbins or wherever you are disposing of your garbage, please knot it up and keep it once you are done with the day work so that these mosquitoes do not breed in there. These breed especially in the hot and humid climates, and therefore these days the mosquitoes can be seen everywhere and people are coming up with these symptoms. So take care and stay safe. If you are having those symptoms, take your rest, take your treatment, consult the doctor. Thank you and have a very nice day. Assalamu alaikum.